I welcome all of you to my YouTube channel at Lafobuko. My YouTube channel at Lafobuko. There I have multiple modules that I've posted, PowerPoints that I've posted. I've posted most of them in English. We will be uploading the same modules in Swahili and in Kupsabin. So if this is not something for you, then just wait and look forward to the modules in the language that you can understand. So miscarriage is one of the biggest things here in Bukwa. I've had a lot of women who come to me. Some people have had 10 abortions or 10 miscarriages, 8 miscarriages, 7 miscarriages. You may have had one baby and then after that multiple miscarriages. Or you have had 2 babies, then after that everything else is an abortion. Or you've had 5 babies, then after that you can't have any more. So that is the topic we want to talk about today. So what is a miscarriage, or what is miscarriage, or what is abortion? This is the unexpected ending of a pregnancy in the first trimester or in the first 20 weeks of gestation. And there's multiple causes of miscarriage or abortion. When we say miscarriage, some people think it's something they did, it's something they ate. It may be or it may not be, but it's nothing to blame yourself for at this moment. Several things can cause this, including just an embryo defect or just poor implantation, like when the sperm has met with that egg and they meet together, they need to implant, but they don't implant correctly. So they easily can come out, okay? So we're gonna look at some causes, symptoms, and all that. What are the common symptoms of an abortion? Sometimes you feel lower back pain, abdominal cramping or lower abdominal pain. You may have irregular contractions. You may have just some spotting, vaginal spotting, mild bleeding or heavy bleeding. It may just be light or heavy bleeding. You may be extremely fatigued or just the normal nausea and vomiting, which is also related to pregnancy. And what causes abortion? What causes abortions? What causes these miscarriages? One of them is infections, UTI, or the group of the torch diseases, which is toxoplasmosis, which is syphilis, hepatitis, rubella, cytomegalovirus, herpes simplex. This group of infections or diseases. Hormonal imbalance that may need to see your gynecologist for, or incompetent cervix. I'll talk about this in the next slide because this is big, and this is something that you can take medicine and take medicine and take medicine, but you still miscarriage. So this is one that I want to talk about in the next slide. Or you just have some uterine abnormalities, or it depends with your age. Are you very young? Are you very old? Okay, or it just the improper implantation, the way we say it. So we want to talk about. So if you have any of this, you need to see your doctor. So any complications, anything that deals with a miscarriage. If you've had the first miscarriage, you need to see a doctor. If you've had 2 miscarriages, you still need to see a doctor. I know in our community we run to the clinic first. This is not a condition that you want to go to the nurse to manage. Here, I don't even recommend that you just go to the clinical officer to manage. This issue of miscarriages, you might actually need to see an MO or a physician or a gynecologist to be able to assess you well, diagnose, and manage the condition well. So I said we were going to talk about incompetent cervix. Maybe you've never had a child, or you've had one normal child or normal delivery, and now every other pregnancy just gets terminated by week 20. So you may be having an incompetent cervix, and this is around this area where I have the arrow here. So the cervix is supposed to be totally closed. When the baby is in, it's supposed to be totally closed. But now it may be having a little opening or a wider opening. So any opening can actually easily cause a miscarriage. Why? When the baby in here is heavy and there's a hole here, It easily can just open up because of that pressure and the baby comes out. Most of the time with incompetent cervix, you may have carried the baby to 4 months, 5 months, and then all of a sudden, with no symptoms, you just feel like you need to go and urinate, you need to go and poop, and all of a sudden the whole baby just comes out, and you're thinking, my God, I've not done anything major today. I didn't even go to the garden today. I didn't wash any clothes today. What happened? So it just may be because of the weight of the baby and because of this incompetent cervix or because of this open cervix, it just opened and the whole baby just came out. Okay. Now, if you have had 2 miscarriages, 3 miscarriages, 4, whatever it is, but usually by the 3rd month to the 5th month, baby just comes out, there is a chance you have an incompetent cervix. This has an easy fix, and the fix to this is stitching. So they come and circlage or they stitch around this area. Okay, they stitch around this area. Now, once they stitch this area, the weight of the baby will not reopen it, and you can carry this baby to term. So that is the area that they stitch, and you can carry this baby to term. And when the baby is ready to be delivered, the doctor will just remove that stitch and you get your baby. A lot of people have said, if you're going to stitch my cervix, will I be able to have sex? Yes, you can. Simply because we are not stitching out here. We are not stitching the vaginal canal. We are stitching up there in the cervix where nothing is affected during sex. So yes, you can still do whatever you are doing. Can you still void? Can you still urinate when they stitch? Yes, the urethra is way out there, so you can still urinate, you can still have sex, and this can still be stitched just to keep the baby. Okay, so this stitching is not going to affect your day-to-day activities of intimacy or of voiding. So yes, if you've had several miscarriages or just a few miscarriages, you need to see a doctor for this one. If it's not an OBGYN, a regular medical doctor or a physician is able to do this for you. So if you've had this, you need to see the doctor before pregnancy. The doctor will follow you up before pregnancy and make sure that when you get pregnant, they keep doing the ultrasounds to see, is it open? Is it opening? How is it open? Should it be stitched together? So if you have any questions about this, you can call us, you can go see your doctor. We are here at Love for Bukwa. We can manage this well for you. We've done it for so many other women who have had so many miscarriages. And when we follow them up and we stitch them up and we come and open and they get a normal baby, they are extremely happy. They smile. They come back with joy. And you can't believe what we feel when we see them hold that first baby after all the misery that they have gone through. So this is an easy thing. So we want you to be seen and to make sure that you do not have another abortion. You do not have another preventable miscarriage. Okay? Bye for now. I'll see you in the next module.